So ZOVA is therapeutic movement. So our goal is to take somebody out of pain and get them moving again. And so we use a lot of different treatment methodologies to do that. So some of that might be chiropractic, some of it might be roots in acupuncture, massage, physical therapeutics, different rehab exercises. So we've studied a lot of those different things, and we continue to study those, and we integrate them into what we do. So it's not just one simple thing, it's a combination of things that involve movement. At ZOVA, we do a lot of different therapeutic procedures. So some of that might be spinal adjusting, which is, chiropractic type adjusting. When I was getting injured in martial arts and doing other different sporting activities, things like shoulders, knees, hips, feet, all those different things, extremity type things interested me, so I studied with every person I could find. So I traveled across the country, went and attended seminars, found all the people who did it, because it wasn't taught very much. So learning extremity adjusting, learning how to do mobilizations, seeking some things overseas, whether it was in some of the Australian physical therapists or New Zealand physical therapists, the rehab from, say, the Prague School of Rehab, learning some of those different therapeutics with that. We do, of course, massage therapy. All those different manual therapies, mobilizations are really refined and key to what we do. And they're subtle, and they're hard to see on videos, whether you see it on Facebook or Instagram, YouTube. There are a lot of specialty things we see. But a lot of those things you see out there as far as therapeutic exercise, we use a lot of those as well and study those just as in depth as we do manual therapies, mobilizations, chiropractic adjustments, chiropractic manipulations. We look at therapeutic exercise. So again, movement is a big part of our practice, so therapeutic exercise is a huge part of it. Studied a fellowship study in clinical biomechanics with posture. So a lot of the things we do with mechanical traction and ways we can stretch ligaments and joints and get curves out, say in neck curves or scoliosis. We treat a lot of those different things as well. In addition, acupuncture, dry needling, those different therapeutics, cupping, doing edge tools like Graston type tools to break up connective tissue fascia. We do all those different things and keep on studying and refining those. We like to do them with movement. Same thing with cupping. So in the cupping you saw in Olympics, they were just suctioning those, creating kind of hickey marks or kind of octopus suction marks, where we like to do it moving. And movement, again, is a lot of what we do. And we might integrate vibration plates. We might do a decompression table for a low back disc or for a neck disc. We do therapeutic taping, which like kinesio taping or rock taping. I got into that about 12 years ago, and so it was finally fun to see when the Olympics, they really started using that. People started seeing what it was, because I used to put it on people and they were like, what in the world is that stuff? So those are just some of the different procedures. We're always learning, always integrating, always traveling, and getting new information on all these different types of things.